As the timeline set by the United Nations for the achievement of the 8 Millennium Development Goals approaches, questions as to how well Nigeria has fared remain resounding. On this episode of the program, we take a look at efforts being made by Nigeria's MDGs office in reducing child mortality and improving maternal health in the country's north-central region of Jigawa State and Akwaibom State in Nigeria's south-south region. I'm Onyi Sunday, and you're watching Eye on MDGs. She would not give us her name, but her condition is shared by thousands of Nigerians. Vesico-vaginal fistula. The depression she feels is so heavy one could touch it. Still a child and a young bride, she lost her baby a few days ago and now suffers from vesico-vaginal fistula, popularly known as VVF. It is a medical condition which occurs when the blood supply to the tissues of the vagina and the bladder are restricted during prolonged obstructed labor. The tissues die between these organs, forming holes through which urine can pass uncontrollably. She walks around with a catheter due to urinary incontinence. According to a research conducted by the Foundation for Women's Health, Research and Development, it is estimated that about 80,000 new cases are recorded annually in Nigeria. The incidence is estimated at 2 per 1,000 deliveries. According to Nigeria's Federal Ministry of Health, more than 500,000 women live with VVF, and that is just a conservative estimate and not accounting for the number of infant lives lost. VVF is not getting much airtime, and connections to infant mortality are not widely publicized. According to World Bank statistics, Nigeria accounts for 10% of the world's maternal and infant mortality rate. In 2004, Nigeria's mortality rate stood at 800 per every 100,000 live births, and an infant mortality rate of 100 in every 1,000 live births. To tackle this, Nigeria's MDG office adopted the Millennium Development Goal acceleration tool, which aims at identifying factors that result in maternal and child deaths.
Right now, the statistics is 350 per 100,000 live births. If we bring it to 250, it's significant. That 100 is very significant. If we give it the last push, using the Millennium Development Goals acceleration framework, we can give it that push, and I think we can achieve it.
In Jigawa State, Nigeria's north-central region, the strategy adopted to reduce infant mortality and improve maternal health is known as the Gunduma Health System. Established in 2007, the Gunduma Health System is Jigawa's version of the World Health Organization's recommended district health system, which brings both primary and secondary healthcare services under one management structure and accountability.
This gives us actually a clear leverage as to how you want policies be implemented. For example, the Jigawa State came up with the free maternal and child health. This clearly addresses ill health of the pregnant woman and children under 5. So this would have been an impossible task or difficult to implement if we have not come into this kind of arrangement.
Through equal contributions from the state and the National MDGs office, Jigawa State has built 132 basic health centers to reach every ward in the state.
This is done around maternal and child health services. What it means, at the basic health care level, a child can be taken there for minor ailment, for immunization services, and the mother also can go for ANC and the health stock. But ideally, delivery cannot be taken at that level because the personnel at that level do not have the required expertise to take delivery at that facility.
The state currently has 640 PHCs and 12 secondary healthcare facilities.
Since the program was started, maybe we may have spent close to 4 billion naira on all the conventional grant scheme projects that is dealing with other sectors, including other sectors, water and sanitation, economic empowerment, and health. But I should say maybe over 60%, over 60 to 70% of this amount was used on in the health sector, and specifically trying to address issues to do with child and maternal mortality rates. We have built about 130 basic health clinics.
Dr. Bello Muhammad is the Jigawa State team leader at the Partnership for Transforming Health Systems, known as PARTS 2, a 6-year national program funded by the UK's Department for International Development to strengthen Nigeria's health system. Currently active in 6 states, the organization supports the entire health system in every state. In Jigawa State, the organization has contributed to the building of healthcare facilities and equipping and training of medical personnel in Jigawa's health system.
We went far supporting the state with over 0.6 billion naira worth of equipment to Jigawa State. The executive governor of Jigawa State was at Megatari some times back to help receive this equipment. We realized that it doesn't make sense just to renovate the facilities. It doesn't make sense just to equip alone, but the person that's going to be manning this must be there. Okay, so human resource for health component comes in.
Having tackled delay owing to the difficulty in accessing medical facilities in the rural communities, the state launched the Safe Motherhood Initiative, known as Hawaii Lafia.
It's a program which is trying to mobilize women and men toward addressing issues that are causing high maternal deaths in the villages. Delays in taking women to hospital, delays in transporting women to the hospital. In fact, it starts with delays in taking the decision whether a woman should be taken to the hospital or not. By the time the family decided that a woman should be hospitalized, that is a delay in transporting the woman to the hospital. But on reaching the hospital, you found another delay before the health facilities now start attending to the woman. So all of these issues are being addressed through the SMID program.
In partnership with the state's Association of Road Transport Workers, most of whom reside in the rural communities, women are conveyed to hospitals at the nick of time if the ambulances cannot reach them immediately. The state, however, realizes that curbing maternal and child mortality goes beyond the provision of facilities. A large number of women who attend antenatal classes do not return to the hospitals to have their babies. This is attributed to the lack of health workers across medical facilities in Jigawa State. Through the Midwives Training Scheme being run by the National Primary Healthcare Board in collaboration with the MDG's office, the deployment of midwives across rural communities in the country is gradually tackling the issue. This, however, cannot address the issue completely. The state currently runs the School of Nursing and Midwifery to complement efforts of the federal government. With a major support from the National MDG's office, the institute is equipped to aid teaching.
Jigawa has the lowest manpower in the health sector. So you find that actually the school is important in the state in that we'll be able to produce our own manpower instead of seeking for manpower from outside the state. Training midwives is highly important in order to reduce maternal mortality. In that, they need assistance in the hospital. If they are not in the hospital, they need assistance in their home in order to be able to have a safe delivery. That's where we start, having a safe delivery.
The provost of the institute, however, notes that there are deeper issues that need to be addressed in order to increase the number of women who utilize available facilities during childbirth.
Now, our women generally squat to deliver. Now, but when they come to the facility, they are made to lie on their back. And they say that is a difficulty. And secondly, there is this belief among the Hausa women, particularly Hausa and Fulani women, that it is a sign of weakness that a woman should go to a facility to be delivered. She should be able to deliver herself.
Another thing that women are afraid of when they come to the hospital, they say maybe our language frighten them. There is that language barrier. Maybe we speak in English, we don't understand Hausa. Then, because like I said earlier on, most of our health workers, they are employed from another state. They are not Hausas, so they can't communicate. So communication is one problem. Two, they said our attitude, the health workers' attitude, which we have addressed. I can boldly say it has been addressed.
The nurses and midwives currently offer home deliveries for women who prefer to have their babies at home. Aiming to curb the high number of home deliveries, the Institute is incorporating child delivery skills for women who prefer to assume a different position during childbirth.
If the woman wants to squat, all I need to do, because I'm standing now, all I need to do, she's squatting. I squat. I bend so as to be able to see the outside opening of the vagina, and then to guide it and guide the head of the baby. She's kneeling, she's bending down. I too am bending down. That is all. I only change position. Nothing different in doing what you're supposed to do professionally.
Karamatu Adamu's baby is 4 days old. A healthy-looking girl, this is Karamatu's 10th child. She has assumed varying delivering positions in her journey through motherhood.
Na gudana ya ta haɗu da lokacin wani sa'ilin da daddare ne, wani sa'ilin mai gida na baya na. Akwai nurse tana zuwa tana duba ne. Na aihu a kwance, na aihu a zaune. Ciwo ne yake damuna.
The proximity of the PHC to her community has made access to medical care easy for her. Karamatu hopes this 10th baby will be her last. Currently, advocacy is a major tool being used by the state and federal governments to ensure women utilize the services available. Advocacy is also a tool being used to address issues causing deaths in children between ages of 0 and 5 and maternal mortality. Here, at one of the state's secondary health facilities, we are told anemia in pregnancy and malnutrition are major cases being treated in women and children at the hospital.
Type of operation also is very common in this hospital in children. Why? Because the parent, most of the time, they don't bring their children to the hospital on time. They keep their children at home, taking traditional medicine or concussions. This only when the condition is bad, they normally bring them to the hospital.
Using the Village Health Workers Initiative of the MDGs, women and men alike are educated on danger signs during pregnancy, as well as the importance of utilizing services rendered by the primary and secondary healthcare facilities. The state is currently partnering with traditional birth attendants to ensure the referral of women to medical facilities. They're also being trained to handle deliveries professionally and to look out for danger signs.
The number of facilities in terms of the so-called reach every ward concept by the National Primary Health Care is still not at 100%. Traditional birth attendants are needed to manage the deliveries before we are able to provide what you call skilled birth attendants. If you don't have those skilled birth attendants, who are you going to be taking the deliveries from? The same people.
After the break, we will be visiting a state that is applying a similar principle but is faced with a rather more complex situation. Do stay with us. Welcome back. If you're just joining us, you're watching Eye on MDGs. Our efforts to assess Nigeria's progress in reducing maternal and child mortality takes us to Akwaibom State in Nigeria's south-south region. Here, the government's strategy to reduce maternal and child mortality is to ensure access to available health facilities. This, the government believes it has achieved through the provision of accessible roads in the rural communities.
These have helped to create access for people to access medical services where they require them. The state government has invested so much in rehabilitation of primary healthcare centers and building new ones. We even went ahead to construct nurses staff quarters in these primary healthcare centers that have high traffic so that we can be able to cope with demand for services by the people.
Access to medical facilities, however, does not translate to quality Medicare. With 361 primary healthcare centers spread across the state, most of them were either abandoned or non-functional. A range of other factors were also noted to be responsible for the high rate of maternal deaths in the state. The lack of adequate medical personnel remains the bane in Nigeria's health sector. Over time, this has been blamed on the administration and structure of the health sector in most states. In Nigeria, tertiary health facilities are run by the federal government. Secondary health facilities are run by the state government, while primary health care centers are run by the local government councils, who are also responsible for the remuneration of the workers at the centers. Akwaibom State is no exception. The inability of the local government to run the facilities in most cases have been blamed on the lack of professional nurses and midwives.
For a successful running of the primary healthcare center, you must have personnel that can run 3 shifts. So here in Surubion, in some facilities, we just have 1 nurse and maybe 1 crew, which means they cannot run the shift. Where we manage to have up to 5, they know how they are arranged. Maybe people on morning duty will work in morning and afternoon, and some people will come on nights. So there's no way, if you don't run 24-hour service in a primary healthcare centers, client utilization will be low, because whenever they come and they see nobody, comes up to 3 times, they will never come again.
That would border on, policy. But what I would say is that we are also making plans, to establish what will be known as the State Primary Healthcare Management Board, which will now be basically a parastatal of the Ministry of Health. And if that happens, probably to a large extent, some of this burden will be lifted off the local government areas. Is that if we can deploy, if we can recruit enough nurses at the state level, maybe we can also consider sending some of them, state nurses now, to help out in certain PHCs to ensure that, that. In fact, as a prelude to that, one of the things I've tried to do is to do a comprehensive audit of all the PHCs. I really needed to know the staff in the PHCs.
The MDG's office is also undertaking training of midwives to be deployed in these facilities. Through the conditional grant scheme of the MDGs, 95 primary healthcare centers have been renovated and equipped between 2009 and 2013. The plan is to build more PHC models like this one in Nsidatai local government area.
This place was nothing to talk about, but now we've gotten, in short, the best health facility in this local government, in Ward 5, Nsidatai local government. It's well built with equipment supply, and we've started using them.
With a solar-powered borehole, the facility is guaranteed 24-hour water supply. Access to potable water remains a problem in most communities in the state. The borehole serves the dual purpose of supplying water to the PHC and many more households.
We're able to build 3 small town water supply schemes across the state, 1 per senatorial district. And one is serving between 10 and 12 villages and has a capacity of 250,000 liters. In 2009 also, we had 92 boreholes to construct for the people. And then 2011, we did 40. And then in 2012, we did 32. And in 2013, we have also about 40 in 2013.
Access to water, potable water is one of the requirements for a good, healthy condition. So we made it. We took a conscious effort to make sure that, since it is one of the things that is required to ensure an healthy environment, that we must make it available.
Structures like this are being replicated in some parts of the state to cater to the medical needs of the communities. Servicing 3 wards and 7 settlements in most communities, the director at the Secretariat PHC in Uyo describes the available number of PHCs as being inadequate.
So we are gradually getting to about 50% of women in attendance to antenatal clinics and routine immunization. I said we have attained 90% as at now. And then if you consider the target population of this particular local government or this particular ward is grossly inadequate.
The Akwaibom State government is bridging the gap between the primary health care centers and the secondary health facilities through so-called cottage hospitals. With ambulances positioned in every local government area, the state plans to establish an emergency ambulance service to ensure patients are reached on time. To further address the reduction of infant mortality, the MDG's office has built and equipped an incubation center at the state's General Hospital in Ikotekbene. The prevention of malaria is another campaign undertaken by the MDGs and the Akwaibom State government. For a malaria endemic environment, the state government, in collaboration with the MDGs, is pursuing this campaign through the provision and distribution of mosquito nets and ensuring a good level of environmental sanitation is maintained across the state. As Akwaibom State continues in its quest to ensure healthcare delivery in every community, it has come to terms with the fact that traditional birth attendants are not going anywhere. To handle the situation better, the state is embarking on their training.
I have meeting with them once every month, every last Tuesday of every month. I used to have meeting with them. We train them on the type of delivery they should take. If you say that there should be no TB here, we are joking. Because even if you tell the community people, no matter the services you provide for them, they will still go to TBAs.
In Akwaibom State, however, the TBAs are a fair challenge when compared to a more worrisome trend that has affected the state over time: the patronage of religious houses by pregnant mothers during delivery.
Now, as a ministry, we've tried to engage the major stakeholders here, which are the churches, to try and discourage women from going to churches to deliver. So we're doing that, but we intend to go a step further to see whether we can get a legislation sponsored that would seek to ban the delivery of women in churches. What we're now saying is that if a church wants to deliver women, they need to go get a facility, do a maternity home, get trained health providers to run it and be regulated by us.
Before now, when people are sick, it is being attributed to one form of spirit or the other. But through the introduction of the village health workers scheme, people are being educated that sickness is as a result of one form of, it cannot be from spirit, that the best way to cure any disease is to go to the hospital. So that has been working very well.
Pastor Akwaibom Ekpon of the Fertile Gospel Ministry is a religious leader who believes the church and hospitals have different roles to play.
I see it as ignorance. The people that really understand what is the word and the Bible does not tell you to give birth. Some people just use the example of the Hebrews. No, it was the knowledge of God at that time. At that time, people were they still acknowledge hospital. But it is ignorance. That is a problem. People should ignore all this sentimental knowledge.
Sundays like this serve as an opportunity for him to enlighten his members on the need to use medical facilities during delivery. The state admits an aggressive campaign to reorientate the women and most religious leaders is a solution to the problem. The MDG's office, through the Village Health Workers Scheme, is currently running this campaign and backing it up with a conditional cash transfer program to attract more women to the health facilities.
We give them 5,000 as our allowance per month. And then you have to meet these specific conditions. Allow your children of school age to be in school. And then pregnant women, make sure you attend antenatal. We are also saving for you 8,333 naira as exit strategy for you at the end of the program, so that you invest at the end of 12 months, you would have saved, or we would have saved for you 100,000. And then we train a member of the household in any trade that will enable the household continue to generate the 5,000 that we are supporting them with.
It is obvious Akwaibom State has recorded some level of progress in curbing maternal and child mortality. In the past 2 years, it has recorded 70% immunization coverage and no recorded case of polio within that period. It, however, admits a whole lot still needs to be done to reduce infant mortality and improve maternal health. With less than 700 days to the Millennium Development Goal deadline, a call for a further push by all and sundry in the achievement of the reduction of child mortality and the improvement of maternal health reverberates now more than ever. We welcome your comments, questions and suggestions on the program. You can email us at the address on your screen or contact us through our website www.cnbcafrica.com. I'm Onyi Sunday. Thanks for watching.